So we've got Kate with us this morning. Hi, Kate.
Hello.
Would you like to introduce yourself and tell us what you do for a job?
So my name is Kate Thitton, and I work as a veterinary nurse. So I work in a very large hospital where we treat mainly dogs, cats, the odd sort of slightly larger animal as well when it's needed. And I work in the orthopaedic part of the department, which means I deal with mostly bone diseases, muscle diseases, and ligaments and things like that.
Okay. So what made you want to be a vet nurse?
Well, I always loved animals since I was a kid. I was always, going over to ask if I can pet the dog. We had a cat growing up, and my dad was always really good at pointing out wildlife and things when we go out on walks. And actually, it was my dad that suggested the career to me. And I researched it a bit. I went into one of my local veterinary hospitals at the time. That was the PDSA in Gillingham. I'm not sure if that exists still. And they had an open day, and I had a look around, and I chatted to a really nice nurse. I think I was probably about 14 at the time, and she sort of answered all my questions, and it just seemed to fit. It just seemed like the best idea in the world. I was really cared about my pets, and it just seemed right that I should go and help look after other people's.
Okay, so that open day, talking to that vet nurse, was something that made you aware that it really was something you wanted to pursue?
Yeah, definitely.
Did you have any careers guidance at school?
I think there was definitely the option to. I don't think that I ever actually really spoke to anybody at school about it, to be honest. I think probably if they asked me, I would have told them that that was something I was interested in. But I never really had an interview or anything like that. I think we did a few sort of online quizzes, the fast tomato thing at some point, but otherwise not especially. But perhaps that's more just because I sort of had it in my head that I knew what I wanted to do. The option was there if I wanted to talk to somebody.
Okay, so what qualifications do you need to become a vet nurse?
So there's a couple of different routes to do it. I went to university and I got a foundation degree. There are other options where you can do it sort of as you're working. So if you're already employed as a student nurse after practice, you sort of get released maybe one day a week, and you go and do it at college. To enrol on any sort of veterinary nursing course, you have to have your basic maths, science, English GCSEs, probably at A to C grade, but it depends whether you're going to go to the university route and do a degree, or if you're doing it through college as like day release. So generally get your core GCSEs in, and then if you're going to go to university, you need to get your UCAS points in and get some A levels under your belt. Probably that would need to include a biology or at least a science in there as well. So I did a foundation degree, and in my A levels I did applied science, which is more like science in industry, and then I also did physical education, which had biology in it as well. And then I also did an animal management diploma or something, which was obviously perfect for me. So that was a really good way for me to get into university.
So were you able to do that animal management diploma at your school?
It was part of a consortium. So at the time, the Medway School, so I went to Thomas Aveling, and the local college, which is now Housing Estate, was the Mid-Kent College. Essentially, it was like taking another A level. So they gave us time to travel to the college to just do a couple of classes on the afternoon. And the school also gave opportunities to go to other schools that were doing different courses, for example, chemistry or biology, whereas my school were only doing applied science. So there was a few opportunities there. Okay.
So did you like school?
I did, actually. Yeah, I mean, I was a bit of a goody two shoes. So I was fairly well behaved, always did my homework, but I did like school. I had a really good bunch of friends, particularly enjoyed sixth form, when everyone was sort of there and really wanted to learn and were sort of working towards what career they wanted and having a bit more of an aim in life, shall we say. But yeah, I really liked it. I always enjoyed school.
So how long have you been doing this job?
I left university in 2011, so I guess that would make it about 10 years now that I've been doing it.
But you've had quite a varied career, haven't you, in terms of places you've worked?
Yes, definitely. So when I left university, I got a job in London, and that was quite a small, 3 nurse, 3 vet practice. I then, put my brave hat on and went and worked in a much larger hospital, also in London, Southeast London. And then after that, I put an even bigger, braver hat on, and I went and worked for a little while in the Middle East, in a smaller practice in Bahrain, which is right near Saudi Arabia. And that was brilliant. That was really good, and gave a really different set of challenges to overcome, and sort of different general problems as well. So not your typical medical or surgical problems that you would be seeing in the UK. So it was also, a learning curve for me as well, to pick up, what was different about that sort of criteria over there.
What is the best bit of your job?
Obviously, it's the dogs and cats. It's the animals. I love working with the animals. They always have really different personalities. It's really interesting getting to the bottom of what those problems are, because they can't sit there and tell you. They can give you markers. So it's quite interesting to figure it out. It's a little puzzle. This is where, they're sort of limping or telling us that it hurts. They're doing this, speaking to the owners as well. I really enjoy talking to the owners, actually. To be a nurse, you've got to be passionate about animals, and it's lovely when you meet the owners who are just as passionate and just as interested, and they really care and they want to know what's going on as well. And I really like working in a team as well. Everybody works together to work towards the same goal. People are really helpful, and people are so knowledgeable as well. There is so much to learn from other people around you, particularly in where I work now, and such a big, we're a teaching hospital, so education is really important. So lots of things, lots and lots of good things.
Okay, and the worst bit of your job?
Well, with the highs, there are always the lows. So I suppose the worst bit is when perhaps an animal is really struggling and there's not much else we can do to help them. As with any medicine and any human interactions as well with medicine, there is only so much that we can do in the laws of physics and nature. So it can get quite sad when you feel that you want to help them as much as you can and you can't. There is obviously always the route to go down where we could do the kindest thing and put them to sleep, and that is very sad, and it can be really hard, and we have to support owners through that. So we have to have a lot of empathy and sympathy, which we all do, as it sort of comes naturally with our job. So one of the hardest things can be to be professional in that situation, even though you're really upset, and it's very sad. You also have to be there for the owner, and you have to advocate for the animal as well. You've got to support them through it. Sometimes if the owners are upset and they don't want to witness their animal being in pain, which is fair enough and happens quite often, you've got to be there to calm the animal, support the animal, and yet do what's best for the animal.
Okay, sounds tough at times.
Yeah.
Is there any protective clothing or uniform that you wear?
Oh yes, so my uniform now that I'm wearing, so we all have tunics, which we change every day. So part of our kind of barrier nursing, we call it, where we create physical barriers between us and the animals. So we might wear a uniform, aprons, gloves. We wear masks, not just for corona reasons at the moment, but we also wear them for protecting us against the animals, and vice versa as well. We might wear hats, boiler suits as well, which are sort of big long sort of all-in-ones, if you will. And particularly when we go into theatre, that really changes. We'll change into what we call a scrub suit. So we wear a separate top and trousers, and even shoes as well. Also a hat and a mask, so that we're not bringing anything that could be potentially dirty or cause an infection inside into a really clean, sterile area.
And are there any specific tools that you use in your job?
Oh, so many. Yes, lots. We wear a whole little you know, superhero utility belt of, you know, pens and scissors and forceps and things. Particularly the things that immediately jump to mind are a stethoscope. So we have to listen to their chest before they're having any sort of sedation or anaesthesia to make sure that they're suitable and there's nothing else going on that we need to worry about. We'll also have a fob watch attached so that we can count their heart rate. Syringes and needles, lots of those sorts of things that people might get very worried about when they're going to the doctors normally, to take blood samples or any other sort of fluid samples. And then there's lots of technical equipment. So part of my job is to go into the surgery with the animals, and when we're fixing fractures, we use a lot of metal implants and things, so we have to use a drill to physically screw those into the bone. So that all gets very complicated and we have to know how to use that. So that's some really quite big, important equipment that we use there as well.
Okay, and finally, would you say this is your dream job?
Oh, I really would. It sounds very gushy, but particularly at the moment, definitely, you know, I'm really sort of in my dream job. You know, I think that it's hard work, and I think that you know, you have to really want to do it, and you know, you've got to be proactive about it as well. You know, it's not a job where you can sit at a desk 9 to 5. It's very active, but I love it. I feel that, you know, we really help the animals, we make a difference, and we get great results at the end of it. Yeah, definitely dream job for sure. And I get to hug all the dogs and cats all the time, so you know.
And sometimes people get you to take their dogs to their wedding for you.
Yes, exactly. Yeah.
It's always good.
Yeah.
Thank you ever so much for your time, Kate.
You're very welcome. My pleasure.